Over the years, it has become more common for women to start taking birth control. The purpose of my speech is to inform my audience about the side effects that birth control has. I have been taking birth control for about 4 years now, so I have experienced most of those side effects. I believe that many people should be educated on what birth control is doing to them and their peers. Although birth control affects every woman differently, today I'll be talking about the possible short-term, long-term, and temporary effects that birth control can have on a woman's body. First, let's get started with the short-term effects that birth control has. According to PlannedParenthood.org, in the article, "What are the side effects of birth control?" it states, many short-term effects include headache, nausea, sore breasts, and changes in period. These side effects usually only last about 3 months. Birth control makes people feel sick and uncomfortable and can cause them to keep going back to the doctor to change the method of birth control they are on until they have found the right one for them. Going back to the doctor repeatedly can get expensive and can cause many women to stop taking birth control altogether because they simply cannot afford it. Next, I'm going to take you through all of the long-term effects that birth control has on a woman's body. According to Healthline.com, in the article, "Is there a limit on how long you can take birth control?" it states, "The long-term use of birth control can increase your risk of cancers like breast, cervical, and liver cancer. It can also cause blood clots, heart attacks, hormonal changes, and infertility. While these effects are uncommon and seem far-fetched, they can still happen to many women after being on birth control for an extended amount of years. By taking birth control, women are risking their overall health, and in many cases, women have a full personality change. It is simple to consider these effects not possible for you because every medication lists these as the possible long-term effects. Everyone can have these effects and should consider all possibilities before taking any type of medication. Now that we have talked about the short and long-term effects, let's jump into something a little less common, and that is the temporary effects of birth control. According to Nurx.com, in the article, "How long does it take to adjust to a new birth control pill?" it states, "There are many side effects that go away after the first 2 to 3 weeks of taking birth control. These include weight gain or loss, migraines, severe cramping, and emotional fluctuations." While these symptoms may not seem terrible, some women consider these the worst part of taking birth control. These symptoms may go away within the first few weeks, but for some women, they last the entire time they are taking birth control. It is easy to overlook these symptoms because they last for such a brief period of time. But in the time they do last, it can be difficult to do everyday tasks like walking and driving. In conclusion, there are many things about birth control that people do not know. The amount of short-term, long-term, and temporary effects that birth control has is shocking. And always remember to research any medication before you decide to take it.